Welcome to our educational video on ossicular chain discontinuity. This condition, though relatively uncommon, can significantly impact hearing. We'll explore what it is, how it happens, and what can be done about it. Prepare to dive into the world of tiny bones with big consequences. Ossicular chain discontinuity, or OCD, arises from a break or separation within the delicate chain of bones in your middle ear. The most common causes include head trauma, such as a blow to the head or a skull fracture, which can physically disrupt the chain. Another frequent culprit is chronic middle ear infections, especially cholesteatoma, which can erode or damage the ossicles over time. Barotrauma, caused by sudden pressure changes, like during diving or flying, can also lead to ossicular damage. Less frequently, congenital abnormalities present at birth can result in malformed or missing ossicles, leading to discontinuity. Finally, previous middle ear surgery, like a mastodectomy, can sometimes, as a rare complication, result in ossicular damage or displacement. Now, let's understand how this condition affects hearing. The ossicular chain, composed of the malleus, incus, and stapes, often called the hammer, anvil, and stirrup, is crucial for sound transmission. Sound waves enter the ear canal, vibrate the eardrum, and these vibrations are then amplified and transmitted through the ossicular chain to the oval window of the inner ear. When a discontinuity occurs, this chain is broken. This interruption prevents efficient sound conduction to the inner ear, because the vibrations can no longer reach the cochlea at the needed intensity. The result is a conductive hearing loss. This is primarily due to the impedance mismatch. The airborne vibrations are no longer efficiently coupled to the fluid-filled inner ear. Ossicular chain discontinuity doesn't affect every age group or demographic equally. While accurate global statistics are hard to obtain, studies suggest head trauma is a more common cause in younger adults. Chronic ear infections and cholesteatoma tend to affect children and adults with a history of recurrent ear problems. Congenital ossicular chain abnormalities are, by definition, present at birth. The prevalence varies depending on geographical location and access to healthcare. Areas with poor access to treatment for ear infections might see higher rates related to infection-induced damage. The most prominent symptom of ossicular chain discontinuity is hearing loss, which is typically conductive in nature. This means that sounds are perceived as quieter, particularly in the affected ear. Patients may also experience tinnitus, or ringing in the ear. In cases caused by trauma, there may be associated symptoms like dizziness, vertigo, or even facial nerve weakness. If the discontinuity stems from chronic ear infections, there might be ear drainage, pain, or a foul odor. The severity of the hearing loss can vary depending on the location and extent of the break in the ossicular chain. Diagnosing ossicular chain discontinuity involves a comprehensive audiological evaluation. This includes pure tone audiometry, which measures hearing thresholds at different frequencies, and tympanometry, which assesses the function of the eardrum and middle ear. Tympanometry typically shows an ad-type tympanogram, which indicates high middle ear compliance. A CT scan of the temporal bone is often performed to visualize the ossicles and identify the site of discontinuity. An otoscopic examination, using a specialized microscope or endoscope to view the ear canal and eardrum, can provide clues, especially if the evidence of cholesteatoma or physical damage. Often an audiologist works in concert with an ENT surgeon to come to a diagnosis. While ossicular chain discontinuity isn't formally classified into distinct types in the same way as some other diseases, it can be categorized based on the location and nature of the discontinuity. For example, the break can occur at the incudostapedial joint, the incutomoleular joint, or involve damage to the stapes footplate. Furthermore, it can be described based on the underlying cause, a traumatic, infectious, or congenital. Understanding the specific location and cause is crucial for planning the appropriate treatment strategy. The primary goal of treatment is to restore hearing. The most common approach is surgical reconstruction of the ossicular chain, called ossiculoplasty. This involves using prosthetic implants to bridge the gap in the chain and re-establish sound transmission. The implants can be made of various materials, including titanium, ceramic, or bone. In cases where the discontinuity is caused by chronic infection or cholesteatoma, the infection must be eradicated first, often involving a mastoidectomy. Hearing aids are an alternative for patients who are not suitable candidates for surgery or who prefer a non-surgical option. The specific treatment plan is tailored to the individual patient based on the location and severity of the discontinuity, the presence of infection, and their overall health. Preventing ossicular chain discontinuity largely focuses on mitigating the risk factors. Prompt and effective treatment of middle ear infections can prevent them from progressing to chronic conditions that damage the ossicles. Wearing appropriate protective gear during activities that carry a risk of head trauma, such as contact sports or construction work, is crucial. Proper ear protection during activities involving rapid pressure changes, such as diving or flying, can help prevent barotrauma. Finally, avoiding the use of cotton swabs or other objects in the ear canal can prevent accidental damage to the eardrum and ossicles. The prognosis for ossicular chain discontinuity is generally good, particularly with surgical intervention. Ossiculoplasty can often restore hearing to a significant extent, improving the patient's quality of life. However, the success rate depends on various factors, including the extent of the damage, the presence of underlying conditions, and the skill of the surgeon. Recent research focuses on improving the design and biocompatibility of ossicular prostheses and developing less invasive surgical techniques. Future advances may involve gene therapy or regenerative medicine to repair damaged ossicles, offering even more effective treatment options.